POV. You're the lead detective in a murder mystery. You have to hear the backstory, interview suspects, chase clues, plan your investigation, and crack the case without missing a single detail. And do it all in 15 minutes.
15 minutes?
Sounds impossible?
Actually, as vets, we do this at least 20 to 24 times a day.
Although I do wish I have more than 15 minutes for each of my patients, but I have to play by the rules, so here is how I make myself as efficient as possible. Tip number 1 is planning. So what I like to do at the start of the day is to look through the diary, to pre-read the history, to know any current medications they're on, any clinical conditions that we are worried about, patients that come in off their legs that we think might develop into something more complex, and also aggressive patients so that they need more time and get their muzzles ready, everything like that. The flow of the consult is generally invite the client in with a smile, ask open questions, and during this time let the animals sniff around, warm up to you so that they don't get too stressed. You don't need to rush to touch them first, unless in an emergency, of course. Then you examine your pet and take your TPR, write things down on your computer as you go along. I like to do that, but also balancing, making sure you're looking eye contact to the client as well so they don't think that you're just ignoring them. Summarize your findings as you are typing the notes. So what I like to do is, after I've done my health check, listen to the patient things, then I turn to the computer and then I summarize and say, okay, so far what we found is that everything in the clinical exam is normal except the high temperature and the pain in the abdomen. So these are your options, and go from there. Have a backup plan and set reminders to report any results if you're taking any blood samples. Final few tips are delegate. So make sure you use everyone in your team. That's what they're there for. If they ask for a nail clip or a blood test and you're running out of time, ask your nurse to see if they can tap in while you see the next consult so you're not too behind. 2. Typing notes. Again, use keyboard shortcuts or practice typing really fast, unless you use some kind of AI software that helps you scribe at the same time. Most of the practices are still, pretty basic, so I actually use 10 fast fingers to train my typing speed. It helps me. If you keep feeling rushed off your feet and, it's not just a single day where suddenly you have lots of emergency, but it happens every day, it's probably time to talk to your receptionist, your managers, management, just to see if they can structure the diary a little bit better. Some places do long hours of consults and a longer lunch break, and some places do a couple of hours of consults, a break for 15 minutes to catch up with your notes and everything, and then followed by another couple hours of consults, and then like a shorter lunch break. So definitely worth exploring the type of structure that works best for you. So now you've had an overview of what a flow of a consultation looks like. Follow to find out what the most common clinical cases that I see day to day as a small animal vet. Can you guess what they are?